Hello, everybody. My name is Benjamin Day, he, him,
And I am Jillian Mason, and I go by she, her pronouns.
and this is Medicare for All, the podcast for everybody who needs healthcare. And Jillian, it turns out there's a lot of those people. There's a lot of
Yeah,
people who need healthcare.
you
Shockingly high
don't
number.
say. You don't
Almost
say.
every human with a body. Now, as
Almost.
probably you all know who are listening, look, I mean, with all the threats facing our country, climate change, we have a predatory economy, corporations buying our elections. There's like literally an overt move towards fascism among the far right in this country. And you would think that politicians would be like laser focused on the existential crisis descending upon us. But instead, we have politicians in the US who are just devoting a considerable amount of their energy and their days to an all out assault on the rights of transgender people. So, although the war on trans people has taken many forms, from the bathroom bills to restricting school curriculum, one of the most just chilling and really frightening is the denial of basic gender-affirming healthcare. So, in places like Texas, which I might add, everyone on this podcast is living in except for me, elected officials have gone, even further by targeting healthcare access for the most vulnerable trans folks, trans children. So in this episode, we are going to be joined by one El Paso family and a local gender-affirming care doctor who are fighting back. Jillian, do you want to introduce our amazing guests?
I could not be more excited to introduce our guest today. All right, and Ben, don't worry, we'll explain any inside Texas jokes to you.
Okay, I'll try and pick up on the slang.
Any and all references to the HEB or Whataburger will be explained.
You've already lost me.
So I want to start out with Lori. Lori Edwards is the director of the Intergenerational Rainbow Link at Borderland Rainbow Center in El Paso, Texas, which is an organization that provides a number of different services to queer people in their community. Lori is a mama bear to her two trans and gender fluid teens, as well as any person who finds themselves in need of a mama bear nearby, which we love. She has a BSNS from Purdue Global, is a certified mental health peer specialist, and pulls from backgrounds in both emergency medicine and education to function as a Jane of all trades who's ready to tackle the unexpected. As an El Paso native, Lori returned to the borderland with her husband to raise their kids close to family. Thank you so much for being with us, Lori.
Thanks for having me.
Awesome. Next, we have Liana, who is Lori's daughter. And Liana is a 16-year-old trans girl who loves gaming, singing, rapping in particular. Maybe we'll get a little piece of that later on. I love hip hop music, and I'd love to hear it coming from you. And she's also a student athletic trainer at her high school. She's also a Girl Scout and a local advocate for LGBTQ rights in her city, which is, again, El Paso. And along with helping the family foster a local pug rescue, she loves spending time with her 2 cats, 2 pugs, and 4 fish. Liana, I have been told that these animals have some really interesting names. This is your first challenge. Can you name all of the animals?
I can. My pugs' names are Flauta and Nita.
Oh,
but they have really long names.
Yeah, well, Flauta's full name is Flautita Cremita Guacamole Salsita Fajita. And Nita's full name is, what was it again?
Cochinita. Cochinita Concha Carnitas Edwards. So we call her Nita for short.
Yeah. There must be some foodies in the family in addition to dog lovers.
2 of our past dogs were Brussels, and their names were Bean and Sprout.
Yeah.
Bean Sprout, yeah. We love
If you
naming our
spell out those names, they're longer than the dogs.
Yes, absolutely.
My 2 cats are named Nitty and Gritty.
Oh, amazing.
And
Awesome.
my 4 fish, I have the first 2 are just normal fish. Their names are Sam Sparks and Flint Lockwood. Cloudy and the Chance of Meatballs with them. And the other 2 are named Floppa and Bingus. Named after
Amazing.
Oh my God, girl, you have got some good naming skills. I like this. I like this a lot. Thank you so much for being here with us today, Liana. I think you're officially our youngest guest ever on the podcast.
Nice.
So you can help me translate some of the Gen Z slang too for that. All right, excellent. So next we have Dr. Tony Marie Ramirez, who is an amazing person, and I am also in love with her beautiful wife, who is an amazing organizer as well. But Tony is a family medicine physician with several years of experience in gender-affirming care. She received her undergraduate and medical school degree from Brown University and trained in family medicine at Santa Rosa UC San Francisco Family Medicine Residency in Northern California. She was born and raised in Socorro, and so she moved back to El Paso in 2020 to be with her family. And her work is strongly grounded in social justice and equity, valuing the power of community empowerment and all the good stuff.
Hi there.
Thank you so much, Tony, for being here with us as well. This is
And what are all your animals' names?
Emilio.
Okay. All right.
All right.
That's pretty good.
Not
All right.
bad.
We'll take it.
Not
It was-
bad.
This is the name of our other kiddo, by the way, which
Oh my
is hilarious.
God.
Non-related, we swear.
All right. So I want to start by asking Liana and Lori. We just want to start off by getting to know you a little bit more and your beautiful family. Liana, if you don't mind talking about it, when did you come out and what was that like?
Well, I came out when I was, so socially I came out when I was 11,
Mm-hmm.
but medically I came out when I was 12.
Mm-hmm.
What was that like for you? I mean, that's a
Yeah.
very young age, right?
It was very young, and I feel like it was difficult at a young age because it was very new to me, and I didn't know that much about it. So it felt like a brand new life to me that I was
Yeah.
living.
Yeah. Mm-hmm.
Was that a good thing? Or
Yes, it was a good thing. I just
Good.
didn't know it at the time.
Yeah. And Lori, how did that kind of impact you as a mom and just as a family?
So I've always been an advocate in the LGBTQ community. So I wasn't entirely shocked. I really wasn't.
Mhm.
I know that there's a lot of families that struggle with that. I was very lucky that we weren't one of them.
Yeah.
She came out to us when she was 9.
Mhm.
So we had
Oh.
about 2 years of just kind of really letting it be. We really wanted it to be her decision. I didn't
Yeah.
want people to kind of say that we had put the idea in her head. And so we wanted her to kind of come out in her own way when she was ready. What we found was that we actually think she would have come out sooner if we had given her the verbiage to do that.
All right.
But because I was so concerned that other people would think that it wasn't her decision, right?
Yeah.
I held back on that verbiage. And so the second she had the verbiage, it was like a light bulb. She was like,
Right.
oh my gosh, that's totally me.
Right. Right.
And how about your friends and your community? You said you came out socially before you came out medically, right? How did your friends receive your coming out, and have they been supportive?
A lot of them were, yeah. I did lose a couple of friends because of it, but a lot of them were very supportive and stayed with me.
That's
Good.
awesome.
Great.
That's awesome. And screw whoever didn't stay with you.
Right.
Yeah.
Not real friends.
Awesome. All right. Well, listen, we'll talk a little bit more about your story, about how you
Mhm.
became real vocal on this particular issue. But first, I also wanted to ask Tony, tell me about how you became a doctor in the first place, and why you wanted to practice this particular kind of medicine.
Yeah, so I literally decided to go into the field of medicine initially out of rebellion.
Mhm.
As a child, I wasn't taken seriously when I said I wanted to become a doctor. You know, we're kids, you're like, be doctor, teacher, just like random, common careers that we state. But when I said I wanted to become a doctor, I just wasn't taken very seriously, despite I was being at the top of my class. And I noticed it when I was young. So I did it. I said, well, that's what I'm going to do. Luckily, I enjoyed it. I was able to survive medical. I think if I hadn't enjoyed it, definitely would have backed out. There are definitely things that I have not enjoyed that I will talk about later in terms of the systems of healthcare, but I really enjoyed the public health aspects, the community health aspects of everything. So I became a family physician that allows me to kind of do full spectrum care. And I came to specialize in gender affirming care specifically. I think one, as a queer person and an ally to the trans community, it was just like a definitive, I needed to do this. I believe that everyone deserves access to equitable health care. And I also have witnessed how much the gender binary has just like infiltrated our healthcare systems, harmful and dangerous. And so I wanted to be able to provide care for a population that isn't really being cared for adequately by the healthcare system. I currently provide for adults only. I've said most of them are doing for adults, mostly because local providers have always been available to provide for youth. But since being back in Texas, I'm gearing up to provide for youth in a neighboring state. Depending on how laws are going.
Right.
Yeah, we'll talk a little bit about why that is
Right.
in a second. But I love that, like, you know, that gender was one of the things that was clearly weaponized against you when you were, you know, starting out, and that, yeah, and that you took that understanding of just how messed up our gendered system is and turn that into your life's work. That's amazing. Yeah. Very cool. Very cool.
So I thought we would start before we get into what's happening in Texas right now. You know, just before the most recent sort of round of legal attacks, just to talk about kind of the baseline challenges to accessing appropriate care in the healthcare system for trans folks. So Tony, could you just tell us a little bit more about kind of what you've witnessed in the years that you've been practicing family medicine, especially gender affirming care? Just like, what do those barriers look like?
Yeah. So as I was thinking through this, I literally can talk for hours on this, unfortunately. You know, but it honestly has made me not want to practice medicine at times. And I think providing gender affirming care is the one thing that like kind of keeps me in this system, you know, for those that go into medicine with the intention of service and providing and contributing to like the health and the well-being of a community. It's very quickly realized that the healthcare system is just not set up for this, right? And you all know this in this aspect, but I think in this context, we pathologize what is out of the norm of like this colonized world, and we ignore the healthcare disparities as a medical community of the trans community. I have seen it, you know, I've been practicing for 10 years total, if you include my residency. And it is astonishing at how little medical providers know about gender affirming care. So it's just an array of like how little we know about gender affirming care. We're not trained in it. It's not part of curriculum in medical school, let alone residency. And that allows us to just like uphold this gender binary in medicine. Like starting from the very beginning, right? Like our socialized aspects are just infiltrated in the way we practice medicine, the way we learn medicine. And I think that what is in terms of the access aspects that comes from that is that we like already are not educated enough to be able to provide such care. We live in a world that is very binary. And I do think that the reason why there's so many disparities are not because of anything innate, right, to trans or gender diverse folks. It is because of the transphobia that exists in the world, the transphobia that exists in medicine. And I see it on a day-to-day basis. I think, you know, we talk about like access. The reason why people aren't accessing care sometimes is a resistance to or fear of discrimination, outright denial of care. I practiced in California for my training and for a couple of years after. And even in California, in a progressive state, progressive area, there were so many barriers to accessing care. One, from feeling safe. Two, we were one gender affirming clinic, out of the entire like county, right by the Bay Area. So even though you think like you're in the Bay Area, surely everybody provides gender affirming care. Very few people providing care. And then we have the insurance companies and just the cost of it. So in California, there's a law that insurance companies must provide for gender affirming care. Like you must be covered. That being said, doesn't mean there's loopholes around this. And where so much of my time was spent on the phone, talking to insurance companies, a peer-to-peer navigator, explaining why this was medically necessary. And so
Wow.
even in the most progressive places, we're seeing constant barriers to just the access to care, the access to the cultural sensitivity of it. I can go on like forever on that. I have like specific on it. I can like add more context.
Yeah, yeah. One of the things that Ben and I know a lot about from our work is some of the ways that, because we know that that transgender folks are universally underinsured, and so that can also obviously be a barrier to care. And we've been thinking a lot. I don't know, Ben, if you wanted to talk about this, about the ways that queer people are funneled into certain jobs and how that actually fades into quality of care issues as well.
Yeah, I think I mean, it's similar to racism in that the transphobia in the marketplace from employers prevents trans folks and queer folks from getting the good jobs that have, you know, good benefits, good insurance coverage. And so any transphobia we see in hiring, just in the economy, translates into discrimination against trans folks, LGBTQ queer folks in healthcare access as well. So I was, as you were talking, Tony, I was like, who is the villain in this? Because you actually named quite a few, and an unexpected one was med schools, for kind of not even doing the education that providers need. But you also kind of touched on maybe provider institutions and insurers. In your mind, is there kind of a, and I guess we can name employers too who are, you know, not giving adequate insurance coverage to folks, but in your mind, is there kind of a one primary villain here, or is it just all around systemic change that needs to happen?
And is it Greg Abbott?
Right.
Yes, and is honestly, we can't even go like even further out there, which is like I've had the opportunity to just like really emphasize in my own practice, is honestly just the inherent like invasiveness of the gender binary and colonization. Like that is why we're here today. It is because the fact that it's at a medical issue of access to stuff. We pathologize. Yes, treatments and stuff need to happen in the medical-ish treatments. Actually, I would argue that anybody should be able to learn and know and how to access hormones and how to use them. But I really do think like the crux of it all, looking at root causes, is just that we had an imposition of like gender and binary and what that looks like. We were never meant to live this way. And now here we are where people are having to prove themselves to be affirmed, to be able to be helped by the medical community. And when you add on the layers of capitalism, insurance companies and private insurers, medical institutions, you just are left with the disparities that we have today.
Yeah. I really like how you tie that to colonization. You feel that really, especially, I feel like in places like Texas, where you know, the colonizer presence is so strong and so kind of overt. You know, that this land used to be indigenous land, where there's very different conception of gender. Yeah, so that gender binary is a lot of part, right, of the Catholics who settled here, et cetera, et cetera. Yeah.
Yes.
And Tony, I had one other question before we also ask Lori and Liana more about their story. In terms of the different sort of strata of insurance, we've got Medicaid, Medicare, the kind of two big public programs. We have private insurance. What's your experience with those different kind of categories of insurance coverage?
It's different in my experience in California and Texas because we're state-based.
Yeah.
My experience in California has been pretty good in the coverage because California has these regulations where you must cover it. So generally good, with the exception of things I talked about where I still have to kind of argue why something is medically necessary. But overall good. They're equatable in some states of coverage. In places like Texas, where Abbott and previous governors have denied expansion of services and denied care, I would say that unfortunately, between all of them, whether it be Medicaid, Medicare, or private, they all still have pretty poor coverage of just even basic healthcare, not even, let alone trans or like affirming care. I think the experience is the same with all of them in that it's still pretty costly. Last thing I'll say is that a lot of times in Texas, and all of them will do this, is that they'll categorize this as specialized care, as in a referral is needed to a specialist, and it doesn't encompass as like in primary care. And so often things aren't covered because there isn't this followed referral process that is necessary. We don't have the exact codes as an institution to cover someone. So we rely on public funds. We rely on organizations like who Lori's works for to really help us get access to care access to care.
Yeah. I mean, it's awesome, Lori, that organizations like yours exist, right? But you certainly shouldn't have to carry the burden of making up for our shitty, healthcare system. So, but thank you for stepping into the foray there. So I wanted to kind of segue into the Texas of it all. So we know for those of you who do not live here in Texas, and maybe for those of you in Texas who weren't paying attention, shame on you. This June is like June 2nd, right? So just in time for Pride Month, our Texas Governor Greg Abbott signed a bill into law that would ban gender-affirming care for trans youth. Without some kind of judicial intervention, which I know we're all hoping, praying, and organizing for, the law is going to go into effect on September 1st. So, Liana and Lori, you've been so vocal on this issue. Can you tell us about how you first learned about this law, and why did you decide that you really had to be the ones to step up and take action?
Good. Oh, me? Oh, yes. Well, I mean, as the parent, I'm going to hear about it first.
Right.
And I kind of was in a weird place because I didn't want her to hear about it from someone else. But I was also getting calls from my family telling me not to tell her,
Wow.
Because they were so concerned. Because for us, it didn't start on June 2nd.
Right.
For us, it started the year before in February.
Right.
When him and Paxton put out their opinion letter telling CPS to investigate us.
Wow.
And, to call us unfit parents and to say that we were abusing her. So to be kind of put in that class of people that would, be considered abusers was offensive and devastating because, out of all the jobs that I have, being their mother is the one that I take the most seriously, obviously. So, I kind of had to weigh how I was going to tell her, what I was going to tell her. She was very young when everything first started happening and we were rolling out of COVID, so there was the COVID stunting that it happened to everybody on top of that. Right. And I think that initially her first responses were kind of just like, well, okay, all right. And then it slowly kind of snowballed into, I don't have a future. And to look at kiddos who have that thought process, it makes everything else impossible. It makes school impossible. It makes setting goals impossible. If you start to struggle, I mean, being a middle schooler is hard anyway.
Yeah. Oh, yeah.
We were battling with this when she was in middle school.
Yeah.
And
it's the worst.
Even back then when you're trying to convince your kiddos like, hey, this is tough, but we'll get through it. When the internal monologue is, Texas doesn't want me to get through it. It's very hard to maintain your grades, to maintain social relationships, to set goals. So it's been pretty impactful. But SB 14, I think, obviously was the biggest slap in our face. I know that there were so many people who, and us included, who, when we first heard about it in April, were immediately wanting to head out to Austin to testify. We sent our testimonial by email because we couldn't drive across the state. If we could have, we would have. But there were so many people who were hopeful. And I think Liana and I just both knew the state that we were in. So we've been in brace for impact mode since last year.
Yeah.
I think that's probably the best way to sum it down. So I think when I finally told Leanna, I think the initial reaction was very age appropriate, which was just kind of like, okay,
Yeah.
you know.
Yeah.
Mhm.
I
Yeah.
think the rest of us who are adults were the ones who were kind of screaming in our heads,
Mhm.
but
Yeah. Yeah. No, a lot
you know,
of screaming.
yeah.
Yeah, absolutely. I mean, Liana, did it ever make you angry at any point? And it sounds like you were kind of sad about it, but how did you feel?
I felt like it was like a state of shock at first. Like I didn't really
Yeah.
understand what was going on, so I just kind of tried to dismiss it.
Yeah.
But then it just kept growing and growing, snowballing until I was like, this is pretty serious. I should probably start taking this more seriously.
I have to say, at your age, you should not have to take world events that seriously.
I shouldn't,
You
but
should not.
I am.
Yeah, you should not have to have people like Greg Abbott and Ken Paxton, by the way, who is about to be impeached, because even in Texas, you can't commit that many crimes and still be our attorney general.
I know, right?
But yeah, yeah, that's just not the way. It's just not the way it should be. But I think we all know that very well. Yeah.
And Tony, what is the impact on patients if this is implemented, like on patients you're caring for? And maybe we can ask the same thing of Laura and Leona afterwards. But
Yeah, I was going to say, I think, Leanna and Lori can definitely say a lot more to that than I can. And I just will say that actually for the adults that I see, it's impacting them as well. I think that's important too, is that like, even though luckily, literally there's like, we're like for adults coming in and saying like, nothing passed to affect their care, it's drastically affecting them as well. They're fearful, they're scared. People are really nervous and appropriately paranoid about what the next steps will be for them. So mostly I'll just comment that it's affecting adults as well,
Yeah.
and fearful of their access in the future.
Oh, so there's a fear that this is like that kids are sort of the first line of attack because they're the most vulnerable, and then this is going to progress to a point where all gender affirming care might be under attack in Texas.
Correct. And there were several introduced in Texas that also did that. They just didn't get very far because, as you said, I think it was the quote unquote just easiest thing to do for youth is first. But there are several bills that were presented and written up to deny access to care to all ages.
Wow. I wonder, because a lot of times, I grew up in the Northeast and I spent most of my life in the Northeast. And a lot of times my friends from up north, they'll say things like, well, that's just Texas, right? You should just leave Texas. What would you say to those folks? Because I have a whole litany of profanity I reserve for those folks. But what would you say to those folks?
I was going to let you, Lori and Leanna, yeah.
You want to?
I'd say that it's just going to keep following us no matter where we go.
Wow.
It's something you can't run away from because it's always just going to catch up with you. And I feel like we have to stand and fight it, or else it's going to take over everything else.
Oh my God, I just got a chill. That's beautiful. Yeah, no, you're totally right? If they get away with it in Texas, they're going to get away with it next in Oklahoma, Louisiana, Alabama, and then it's eventually going to spread through the whole country. Yeah, absolutely. Yeah, I think also some people who say, like, if you don't like a state's politics, you should get out of that state. They underestimate just how inaccessible that is for most people. I have friends who have been trying to get out of Texas for a while and can't do it. And then the other thing is just that, I don't know, I always say this, I think Texas is worth fighting for.
Yeah, exactly.
Like, we got awesome people here, right?
Yeah. Well, we both left and came back. Tony and I both left and came back.
Yeah.
So, I came back because I wanted to raise my kids here.
Yeah. Absolutely.
Yeah, it's the same thing as that, my friends in California, friends on East Coast and West Coast, and they said, like, I can't believe you did that. Like, why would you do that? And the answer is family. The answer is community. It's really hard to not live in the community and just watch it happen. Watch the all around atrocities, just like injustices happening our state legislators here. And so I think, for Lori coming back the same way to raise a family is just, from my perspective, like this is where I need to be. And I think it's no different for any other gender diverse individuals. Not all feel that way. All would take the first chance to get out, right? Like that's very true logistically. So I think there's a varied amount of reasons, but it is not that easy. And some of us choose to be here. We want to fight, just like Leanna said, fight until that changes for us.
Absolutely.
Yeah, and we like to tell folks in our Medicare for All movement that most national social movements that win and make real transformational change in the United States, they come out of the South, actually. And if we can't win in the South, we actually can't win for everyone else either nationally. So I think organizing leadership in Southern states is just extraordinarily important. And I wanted to ask you, Lori and Liana, especially about just your decision to kind of start speaking out and your experience speaking out. I mean, we train our activists who have been impacted by the healthcare system in all sorts of different ways, how to tell their story publicly. And that is, 100% needed if we want to win social change. But it can also be, I probably don't need to tell you, it can be very challenging. It's kind of a form of emotional labor, like telling your personal story out in public. And it can also put a target on your back for criticism. I mean, Lori, you talked a little bit about just the attacks that have already come on your family, which is really terrifying and horrible. So you've both been like really brave and vocal about defending trans kids. Do you just want to talk a little bit about your experience speaking out publicly, both like good and the bad?
I'll let Liana go first because our experiences are actually very different.
Oh, okay. Yeah.
But speaking.
Yeah, like how has it impacted you?
Maybe
Speaking out.
Maybe we could actually start with what was the first time that you spoke out publicly?
Yeah.
I don't remember.
That was an El Paso Matters interview.
Oh, yes, that was a long time ago.
Oh, yeah, ages ago.
Right? When she was a kid.
Yeah, back in the day. Do you remember
How
what
did that
that
affect
was
you?
like talking to that reporter? Or
It felt really awkward for me at first because I'm not used to interviews. I am now. It was my first time, and I had felt really scared to talk in front of that it would be going to that many people. But after I realized that a lot of people would look up to that and use it for guidance or just for information that they may need, it felt much better to do it.
Yeah, absolutely. Yeah.
Have you got positive feedback from folks? Do you feel like you've been making a difference by speaking out publicly?
Yes, I do.
Oh, good.
Yeah. And how has your experience been different, Lori?
Well, so as the mama bear, I see all the other stuff. Because what I've found is that actually people aren't always brave enough to be ugly to your face.
Yeah.
So, and I've actually appreciated that because I don't want them to be ugly to her face, right?
Fair.
But sometimes they're a little bit more brave to be ugly to me. And that's because that's that degree of separation. And I would gladly shoulder that any day so that nobody says even an unkind word, obviously, to either of my children. But I think the reason that it was a little bit different for me is that when she first came out to us when she was 9, I immediately researched everything. I got onto every family board I could join, every group, everything online. And so this was around the time that Jazz Jennings was just starting to come out. And I watched her family. Her mom was a really amazing mama bear, obviously, but was so kind to those of us who were just kind of flies on the wall at the time. She was well into the journey with Jazz, and she shared a lot of stuff, not just with her show online, but I got to read a lot of, the kind of situations that she was going through with interviews and such at that time. So with that, I got to see and learn some of the do's and do nots, some of the things that were, don't do this because this will end badly type situation. And I banked that, right? I learned about that, should that ever be my future. When Liana first came out, I did not speak out to anybody. I knew that being stealth was not safe.
Right.
because being stealth isn't safe. It just isn't. It gives you a false sense of security, and we knew that to be visible was to be safe. So when we first made the decision to start speaking out, obviously Liana had to be ready first. So initially, the first interviews that I did were alone. And then as she started to feel more comfortable, and I guess feel that kind of pull to kind of representing the people who couldn't step out, who couldn't be visible either because they didn't have supportive families or were just too afraid.
Yeah.
We realized that we have a lot of privilege to be able to do that, and not everybody has that. So when we first spoke out, we knew that there was going to be issues with people kind of seeking us out,
Yeah,
Googling our name,
Yeah.
or finding us on Facebook. And so I've found that it depends on which media you are giving the interview to, what kind of feedback you're going to get.
Yeah.
I've found that print and kind of like online articles are a lot kinder, believe it or not, than running on your local news station.
Sure.
That tends to give you a lot more scary feedback.
Oh my
I think
God, the
because
comment
it's so local.
section in the local news is terrifying.
Yeah, it's bad. It's really bad, for sure. So, I mean, there's been a lot of situations like that. I know that, like, for instance, we put her younger sibling at a different school. And we did that so that they could have two entirely different existences. We never wanted the younger kiddo to feel like they were in her shadow. And we never wanted her to feel like she had to censor herself because it was going to affect someone else.
Yeah.
So there's been positives and negatives. For the most part, though, I will say, at least in the area that I live in here, it's been positive. So it's very, very few and far between that we get negative comments. A lot of the negative comments that I've gotten recently from the articles that we got from local media were actually stemmed out of Central Texas. So,
sorry, Ben, that's a thing. I would have believed Central. I would have believed East. Yeah. Texas, for those of you who are listening and are not familiar with Texas, Texas is a huge, huge state. I live on one side of it, and Tony and Lori and Liana live on the other side. We're about 12 hours apart.
We can get to California faster than we can get to you.
Exactly. So Texas, the different areas of Texas have their own politics, and a lot of them, a lot of the bad ones are located in the central and east area. Anyone who wants to, anyone from like Beaumont who wants to come fight me on that, come fight me. Cool. Well, I'm glad that you guys have had have had an overall supportive experience, and I'm super impressed with the fact that you were willing to do that. I have to say, I don't think at your age, Liana, I don't think I would have been. I don't think I would have been as brave as you, and that makes me think that I, even as an adult, need to be more brave in my own life.
I was going to say, to add that, coming from California, Mara and I, my wife and I, we didn't know what to really expect, having I lived away for so long. My wife lived in a lot of progressive states, and we're very vocal in California. We were just like in front, in center, megaphone everywhere, never having any fear. And when we moved back, we had to sit and talk about how are we going to move forward here. And we did step back quite a bit. And we didn't know what to expect. And this was all gender affirming stuff and abortion rights stuff here in Texas. We didn't want to risk our family's safety initially. So we literally just were watching and seeing what was reasonable. And, honestly, I don't think I've told Lori this and Lori and Liana, but like watching Lori and Liana has helped us realize, like, yeah, we can do this, like they're at the forefront and doing this. So yes, Texas is scary. In the past couple of years, but it's really given us the green light and the expectation that we need to stand side by side as well.
That's so awesome.
Amazing.
So really
that's incredible. Yeah. That is absolutely fantastic. And So here at Healthcare Now, obviously, we were really proud to be standing in the fight with our trans brothers, sisters, theys and thems, and we are all of our siblings. We've actually been fighting for a long time to try to get gender-affirming care into the Medicare for All bill, right? Our idea is that we want to pass a Medicare for All bill that would allow everyone to have basic health care. But, previous plans to do that, right, have actually not included things like gender affirming care or abortion. And so one of the things that Ben has been particularly vocal on for many years, and from other folks in our organization, including Stephanie Nakajima, was that this is a time when we have to say those things out loud and define those things as basic health care. So basically, thanks to those lobbying efforts, right, and for millions of calls from people all over the country to their legislators, the legislators have realized that today is a new day. And so the latest version of the Medicare for All bill would actually guarantee the right to gender affirming care for everyone in the United States, no matter what their zip code or their income level is.
Yeah.
And so, obviously we're far away. We know we're far away from passing Medicare for All, but we really think that this is a good vehicle for enshrining these things as healthcare rights. So I kind of just wondered how y'all felt about the whole Medicare for All issue and how having that kind of access might impact you. I don't know if Lori, you wanted to go first. Yeah.
I mean, to be able to, it would be life-changing for us. I mean, just if you had asked me 4 weeks ago, and Dr. Ramirez can explain this to you. I was like, 4 weeks ago, I didn't know if I could stay where I'm sitting right at this moment.
Yeah.
4 weeks ago, I was putting down a down payment on a little studio apartment in New Mexico because I thought I was going to have to move to take Liana there. So if something like this were to pass, where it wouldn't be an issue of where I lived, it wouldn't be an issue of how much I made, I could provide for my daughter, it would be amazing, but not just for her, for our whole community.
Yeah.
I mean, there's so many people that are affected. I mean, and I'm sure Tony can say way more than that about that, because she's with the community a lot more than I am. She can see the people who would benefit from that. It would be life-changing. It would be life-changing for us, but to be able to see my 16-year-old not have to carry the weight of worry on her shoulders, if she shouldn't have to worry about her insurance as a 16-year-old.
Yes.
When there's other kiddos that are like, I'm going to work at McDonald's, she's like, well, do they have insurance?
Right.
Things that we really shouldn't have to struggle with,
Yeah, absolutely. Absolutely.
If you can say one thing about Medicare for All, it's that everyone could then work at McDonald's if they wanted to.
And that's great, because working at McDonald's is a great job and has dignity, and it should be
totally provides insurance. I mean, not just insurance, but educational stuff afterwards too.
$15 in a union for all McDonald's employees, by the way. Just an incidental there. Tony, I mean, what's your perception of that? Is that something, I know that you pointed to a lot of larger factors, right, that certainly wouldn't be changed by Medicare for All, and we always want to acknowledge that.
Yes.
But just thinking, do you think that would make a dent, or
Yes, and dramatic, just like Lori said, it would be literally life-saving for so many people beyond those accessing gender-affirming care. I'm a huge proponent of Medicare for All. People ask me, as a provider, what are some things that you could change about your work or providing access to care? One is our food systems. Two is having universal coverage. Medicare for All, I think, is the best way that we have right now is to do that and move forward to that, to the full coverage. I think that coverage now in terms of Medicare for All, or that access, means safety. It means equity. When this care is denied or thought of as cosmetic, when it's not included very specifically in these aspects, then it allows for the narrative to continue that it's wrong, it's dangerous, it's questionable. All of those things. So coverage means validation. Yes, this is medically necessary. So I do see Medicare for All as being it's one thing that I work on strongly as well, because I do see it as a way to just like remove a lot of the inequities we have. Access is one thing, but equitable access is another thing. Like what kind of care we're getting. Remove all the funding, remove all the like for-profit kind of stuff. My goal, right, is that we work on prevention. We work on like really getting to the root causes of everything, and like money's just like not the main priority. So I'm super excited about what I strongly believe that I'm going to live to see Medicare for all, however it starts off or like it gets moving. And last thing I'm going to say is that, Lori and I we met because of working in the community. So like I'm not their medical provider, but we met because we are literally trying our best to make up for all that is not provided in the medical system right now. Fundraising to provide food for people, fundraising to provide for their medications. And if something like this happens, like now our funds are for joy and to like,
oh my God,
in the world, right? Versus running around messaging each other, of like, have you talked to this person? Can you access this person? That's not what we need to be doing with our lives. We're doing it for now, but that would kind of remove all of that.
Yeah, absolutely. Yeah. So I think we wanted to turn it over to Liana, right, Ben?
Oh, Liana, would you like to have the final word here and just, tell us, what's one thing you would like folks in our audience to know about this fight, and how can people listening, be better allies to support you in this fight?
I think that I would like the people to know listening that we're doing this all the time. We're constantly fighting, not just during Pride Month, not just during June, all the time, the whole year, 24/7. And I think it'd be helpful if, and I want to pull like an Uncle Sam here, but we need you to help us.
Do you want to strike the pose?
We need you.
That's awesome. Fantastic.
Yeah.
Well,
thank you
all
so
much.
Yeah, I really appreciate the work you all are doing. I mean, until we can win this Medicare for all the work you all are doing is crucial. It's saving lives, our own and other folks in our communities. And it's literally all we can do right now until we win the big kind of structural reforms. So thank you so much for everything you're doing and for talking to us, the humble Medicare for All podcast. So
we're like the least high profile interview you've done. So.
Yes. But the friendliest and most supportive.
Yeah, the most fun.
And
walking in knowing that you have full support of the people you're talking to, and not trying to make sure that you're saying the things that you want them to exactly say.
Yeah.
It's in the family, so we're trying to figure out how to win this all together. So thank you so much. And I also want to thank, we have a podcast team of volunteers who helped this whole podcast happen. Our podcast manager is Angelique Davis. Our researcher and show notes writer for this episode was Joanna Borla, and our audio editor was Christian Brandt. Don't forget to like the episode, subscribe to the Medicare for All podcast on your favorite podcast platform. And this show is a project of the Healthcare Now Education Fund. So if you'd like to support our work, you can donate at our website, healthcare-now.org. And we'll see you all in a couple of weeks. Bye, everyone.
Stay safe and stay